Hey, I'm back, and I'm being a little goofy dude. I'm not dead. I'm not dying. Before this event happened, so recently I went to the ER. I had chest pains and a lot of other symptoms. Had head issues, dizzy, stuff like that. So I thought I was having a heart attack, stroke. You know, they said they didn't find anything. I still feel like they found something. Or not that they found, I still feel like something was happening that was big. To me, it was big. It was very scary. And anyways, I felt like I'm going to have an impromptu share time talking about it, talking about bradycardia. Oh, I brought my thing over. I don't know where it is now. I brought a thing that you put on your finger. Oh my god. Oh my god. It was literally in my pocket. I'm dumb. I'm dumb. So I just got up and did all of that. Let's see. Even with that, I'm guessing it'll be 42. Let's see. 42. 42. And, but it's backwards. And 96. Let's see. I'm going to try and bring it down. 51. Back to 48, 47. 38, 37. Okay, we'll stop at 37. I could make it go a little bit, could make it get a little bit lower if I was, literally having my hands down and really like relaxing like that. So crazy, crazy, crazy. So that's that. Apparently, when I was in the hospital, when I got discharged, I didn't look at that. They gave me a bunch of like a pamphlet. They gave me a huge amount of papers. And so here's the discharge instructions for angina, which is you have been diagnosed with a type of chest pain called angina. Like I said before, when I was making that last video, I hadn't even looked at all of these sheets, so I didn't know that I was diagnosed with a chest pain called angina. Angina occurs when your heart muscle doesn't get enough oxygen. It's most often felt under your breastbone, in your left shoulder, or down your left arm. And it's definitely like, yeah, that's where I keep feeling it. So I think there's a possibility I've had a like low level, barely there, that I just was like, it's so silly, but it was so low level that it was like on the level of mild heartburn, like where you're like, that doesn't feel comfortable, but it's not like it's not like impacting my life. And I think I've just been like dealing with it, and it's so low level again. It's like it almost feels like a phantom pain or something, like I'm making it up. But of course, this wasn't like when I went to the ER. Of course, this wasn't. This was what I felt. I felt bad. I felt bad. And then and I felt even worse the previous week. So luckily, at this point, I'm not having any dizziness. I'm not having anything else. So the pain may even spread to your jaw or back. Women may experience discomfort in different areas. Exercise, increased activity, emotional upset, or stress can trigger this pain. With proper treatment and lifestyle changes to reduce risk factors, most people with angina are able to maintain a full and active life. Oh, isn't that nice? But it still sounds not great. Oh, don't worry. Angina just occurs when your heart muscle doesn't get enough oxygen. But I guess, that is that what I'm experiencing right now? Angina? Even though it's like really, really, really low level. And the thing is, like, I feel like I've been running a lot more. And I feel like that's probably best because whenever I run, it's, I notice, if I keep this thing on or look at it a bunch for like a couple hours afterwards, my heart rate ends up getting a lot stronger. Okay, so managing risk factors. Your healthcare provider will work with you to make lifestyle changes, blah, blah, blah. This can help prevent coronary artery disease from getting worse, which is likely the cause of your angina. I don't want to know that. That's a horrible thing. I remember when I read this the first time and I got to that part. This can help prevent coronary artery disease from getting worse. It's like, wait a second. You didn't say anything about that. So now I have coronary artery. It's still just 37. So now I just have coronary artery disease. It's probably not going to drop below this while I'm talking. So that's not good. I mean, I guess it's obvious, but coronary artery disease is a narrowing of the blood vessels that supply oxygen and nutrients to the heart muscle. The blood vessels can also spasm and reduce the oxygen reaching the heart muscle from the narrowing inside of the artery. Managing risk factors may prevent both of these causes of the narrowing of your arteries. It goes to the diet, which is all the things that you would expect. Physical activity. Okay, so your healthcare provider may recommend that you increase your physical activity if you have not been as active as possible. This may include moderate to vigorous intensity physical activity for at least 30 to 60 minutes each day for 5 to 7 days per week. A few examples of moderate to vigorous intensity physical activity include walking at a brisk pace, about 3 to 4 miles per hour, jogging or running, swimming, or water aerobics, hiking, dancing, martial arts, tennis, riding a bike. So even though exercise, increased activity, emotional upset, or stress can trigger the pain, they also say go ahead and do it. All right, sure. Call 911. If angina gets worse, it continues, or if it stops and returns, call 911 right away. Don't delay. You may be having a heart attack. Don't wait until your symptoms are severe. That's the hard thing. You never know, like, how severe is severe? How bad does it need to be before you go in? Other reasons to call 911 besides chest pain include trouble breathing, feeling lightheaded, faint, or dizzy, rapid heartbeat, slower than usual heart rate compared to your normal, angina with weakness, dizziness, fainting, heavy sweating, nausea or vomiting, extreme drowsiness or confusion, weakness of an arm or leg or on one side of the face, which I was constantly getting, the one side of the face thing. They even let me out and I was still having issues, but yeah. Lovely picture of the heart. There it is. There's the awful thing that's not working anymore in my body. Understanding bradycardia. Your heart has an electrical system that sends signals to control the heartbeat. Any abnormal change in the speed or pattern of the heartbeat is called an arrhythmia. Now, I didn't have any arrhythmia. An arrhythmia that causes the heart to beat slower than normal is called bradycardia. I guess I have an arrhythmia. Okay, what I meant is that I didn't have anything like my mother has AFib, atria. I don't know what that stands for. Fibriosis or fibro something. I'm sure it'll say it later. Apparently, she got she had a treatment where they like burned one of the things in the heart. There are many types of bradycardia. In healthy children and adults, bradycardia is often normal, particularly during sleep. Sometimes bradycardia is caused by failure of the heart's natural timer or failure of the electrical pathways within the heart. Depending on the type you have and how severe it is, you may need treatment. I may need treatment. And I really, at this point, especially if I tell them I still feel very low level, I wouldn't be shocked if I end up having to get a pacemaker. It seems that people in their 30s, heart rate in their 30s, seems like they are the most likely to get a pacemaker to control for that or something like that. And I really don't want one. And but I'll do what I guess I gotta do. I mean, at one point, one of the nurses, besides a pacemaker, was also talking about also having a pacemaker plus the thing that shocks your heart if it gets too low or too high. I was like, no, you don't need to do all that. So what causes bradycardia? Many things cause bradycardia, including the natural aging process, coronary artery disease, heart attacks, heart muscle disease, problem with SA, I don't know how to say this, sinoatrial. I'm sure that was correct. Good job, me. Sinoatrial node, SA. This is the heart's natural pacemaker that starts each heartbeat. Problems with electrical pathways in the heart, problems with the structure of the heart that you're born with, an infection, use of certain medicines, electrolyte imbalances, underactive thyroid, sleep apnea, increased pressure in the brain, or stroke. Well-conditioned athletes often have a naturally slow heart rate. See, that's what I always hoped that I was. I was like, guys, don't worry. I'm just a well-conditioned athlete. So what is it? So, I mean, at one point in my life, I was running basically every day for 5 to 7 miles. That was my norm. And one of the reasons that I did that was because I had no life and I had ADHD. So I've kind of been obsessed with my health all of my life. So that makes this kind of annoying. I kind of got obsessed with my health because when I was a kid, when I was in elementary school, I was fat. I was a fat kid. And I was bullied. And I thought, you know what? I'm going to stop being a fat kid. And I'm going to stop being shy and stuff like that. And that didn't work out for me. But, obviously I'm not really a fat kid anymore. Not a kid anymore. But that also kind of started a interest in just being healthy. Now, sometimes that interest goes out of whack, and I do things that are unhealthy and attempt at being healthy. For instance, in my last video, I talked about taking 50,000 IUs of vitamin D, which the more I think about this, the more I think like maybe that wasn't even a problem. Maybe that's not the trigger. Maybe that didn't matter. Maybe taking testosterone really didn't matter. Maybe that had nothing to do with any of this. The other thing that I wrote in the description of my last video talking about my heart issues, something that I didn't remember to bring up, I have really bad gums, really bad bleeding gums. I haven't been able to see a dentist and get everything cleaned and looked at. I've always had issues with bleeding gums. And there is a possibility that you can develop heart disease, heart issues, by having bad hygiene in the mouth. So I have, bought toothbrushes. I bought those little things that you use to help floss, because I can't do the wrapping around the floss around your finger and then doing that whole I can't do that. I can't do that. So I just take those little here's another thing, OCPD. I'm environmentally friendly. I think about the environment, and every time I used one of those little plastic things, I'd throw that away, and I'd be like, I'm using so much plastic just to floss my teeth for one time. So I went on to Amazon and I bought these specific, they should be biodegradable, made with something, I don't know what, but not plastic. So at least that's one more reason why not that that's the reason I didn't floss, but small things like that end up actually impacting what I do. So that was one more idea that I had about maybe why things were going bad. And yeah. Let's see if there's anything else. Oh, and then this is something else. Like all my life, for the most part, I've had depression, and I've just dealt with a lot of things. And I think about now. Don't often think about it. I think about it now, where I'm like, could a slow heartbeat affect everything else? Like affect just the way you acted in the world? Like if you're depressed, you literally you're depressed. You're like, oh, I feel so sad. I feel so depressed. Like, could it be that like my heart being depressed, my heart not beating fast enough, actually kind of makes me move slower in the world? Or, if you had a really fast heartbeat, like bradycardia, I think that's what it's called. I think I guessed correctly last time I was talking about this. If you had a very fast heartbeat, would you be more prone to anxiety? What are the symptoms of bradycardia? Bradycardia can cause an irregular heartbeat. It can also make it harder for the heart to pump blood to the body. This may cause symptoms such as tiredness, fatigue, weakness, loss of ability to exercise, shortness of breath, dizziness or fainting, chest pain, swelling in your legs or feet. Swelling in your legs and feet. Some people with bradycardia have no symptoms at all. How is bradycardia treated? Treatment for bradycardia depends on the cause. It also depends on the types that you have and how severe your symptoms are. If you need treatment, your options may include treatment of the underlying cause, if the cause can be fixed. For instance, if a medicine is causing it, stopping the medicine, or if a condition such as an underactive thyroid is the cause, treating the thyroid may keep bradycardia from coming back. Some medicines can also treat conditions that cause bradycardia. Some medicines can also be used in the short term to increase the heart rate. These are generally given through an IV line and therefore are not long-term solutions. Pacemaker. Boo, I don't want a pacemaker. Pacemaker, this is a device that is placed permanently under the skin, usually in your chest, and connected to your heart. The device monitors, make sure I'm not showing anything. The device monitors your heart, and when the heart beats too slowly, the device sends electrical impulses to keep the heart beating at the right pace. Temporary pacemaker. A temporary pacemaker may be connected to the heart using wires guided through a blood vessel in your neck or leg to the heart. This is also sometimes done using special pads placed on the chest. This may be used in an emergency as a bridge to permanent pacing, when pacing is only needed short term or to further evaluate your condition. What are possible complications of bradycardia? These include, or can include, the development of other types of arrhythmias, falls or fainting, and injuries that happen as a result. Heart failure. This problem occurs when the heart weakens so much that it no longer pumps blood well, or sudden cardiac arrest. This is when the heart suddenly stops beating. These are fun. These are fun to read. What should I call my healthcare provider? Obvious stuff. Yeah. Yeah. One of the first things that they had printed out was when to use the emergency room. And I was like, are they trying to say something right now? I mean, maybe they just print this out for everybody, but like, an emergency means you could die if you don't get care quickly. How am I supposed to know? How am I supposed to know if I could die? Or you could be hurt permanently, disabled. And quite frankly, at that point, at the point that I went in, I really just didn't know anymore. Yeah. But on the week prior to when I went in, I probably, that would have been the time to go in. Anyways, dangers to your life. This is for anybody who needs to know. A hard time breathing, severe chest pain, a fast or pounding heartbeat, or fluttering in your heart, choking, severe bleeding, suddenly unable to move or speak, suddenly not being able to feel an arm or leg, blacking out, like fainting, poisoning, coughing or vomiting blood, severe. I'd be going to the ER for that one. Severe lasting vomiting or diarrhea, severe belly, abdominal pain, changes in mental status or confusion, trouble waking up, abnormal behavior, changes in vision, sudden onset of the worst headache of your life, suicidal thoughts or of harming another person. Oh, there's the Holter monitor stuff that I've had off. I had a Holter monitor. I had a Holter E patch or something that I took off mid last week. So, shuffling papers. I like this discharge instructions. For patients who smoke, you should quit. It is the most important thing you can do for your health. It's crazy the amount of like younger people. I'm not that young, but younger people that got into vaping. They're like, this is fine. No, it's not. It's slightly better than smoking. Guidelines for healthy living, smoking, don't do it. Obesity, don't do it. Weight monitoring, do it. Stroke. Stroke, modifiable risk factors. Monitor your blood pressure. If it is high, make sure you are treated. Find out if you, oh, there it is. There it is. There it is. My mom has this. Find out if you have atrial fibrillation, which is an irregular heartbeat that allows blood to pool in the heart and cause blood clots. So my mom had that. She got something in there, probably the atrial something burned, and that fixed it all up. Stop smoking, check your cholesterol levels, make sure your bad cholesterol is controlled, manage your diabetes, exercise often, eat foods low in sodium and saturated trans fats. That's one thing that I'm not sure about for me. It says eat foods low in sodium salt. The sodium is salt. So, but I sweat a lot. So I sweat so much that my blood pressure might actually go down a lot. And so one thing you lose in your sweat is sodium. And I believe one thing you also lose is maybe magnesium. And that's one thing I'm still supplementing with, is magnesium. No longer doing the vitamin D because I think I got enough of that. And I'm getting a little bit, once again, OCPD. I started to think a little bit about the whole, like, first of all, I'm always thinking about my chapped lips. I'm sorry, I feel like I got chapped lips. And if you have an obsession with my chapped lips, do you? I do. Every time I look at these videos and edit them, I'm like, oh god, those lips. Oh, chapped. Put something on those, dude. And then sometimes I think about talking like this, showing my bottom teeth. So that's the other thing. When I was younger and got made fun of for being fat, it started this lifelong, like, obsessive compulsive perfectionism when it comes to my body and my face. And I look at my neck, I'm like, my neck's too small. I need a thick neck to show that I've got muscles, and my ears are too big, and my lips are too chapped, and my eyebrow is weird on this side because of something I won't get into. And it is constant. And I know that it's stupid, and I know I'm not a bad looking dude, but like I obsess about it. And so I obsess about all these other things. It's not just health, it's health plus the physical manifestation, I guess, of health. And all these other things. I'm a crazy person. Diabetes, immunizations. That's it. That's the stuff. So yeah, I'm still going through things in my mind, but right now I'm just waiting for a couple weeks. I'll go talk to the cardiologist, and that's it. But I thought I would just like do like check-ins every once in a while and just like separate my heart thoughts from any other videos that I do, my normal videos, where I blather anyway, so I don't know what it matters if I separate it, but this is more specific, so I guess I don't know. And also I just figured I'd probably whine more about my fears or something. But I'm slowly like going back to normal. I spoke to my therapist this past week and pretty much didn't bring up the heart issues at all. Even though the week prior I was like thinking about sad thoughts and death and dying and my mortality and feeling like, man, I'm too young to get into health problems. And but and thinking regretful things and stuff. So immediately, it's amazing how quick when you're used to having specific issues, it's amazing how quick you just go back to it. Just like I felt like I didn't think that I could die. Although when the nurses all freaked out and panicked and stuff, that was me going, "Oh my God, what's happening?" But I didn't really think that anything was truly bad. And and for a while thinking negatively about taking all that vitamin D and did I cause some calcification of my arteries and was that the issue? Those kind of things, but those kind of regrets. But after I got over those regrets, I immediately went to the regrets of my normal thoughts. So I think I'm gonna end it there. Bye bye. I'll talk to you in the future, and maybe there's something playing over here, maybe not. I don't know. I set it up so maybe I could put it over there if I have a video of me drawing. If not, then then not. Thank you for watching and listening. Bye bye.